Do you know anything about ACEs, or have you heard of ACEs? Adverse childhood experiences. It's trauma events or situations that occurred in childhood, such as trauma in physical, mental, sexual abuse, neglect, household dysfunctions like substance abuse, mental health illnesses, parental divorces, domestic violence, as well as witnessing domestic violence. And divorce could have a long-term lasting effect on children into adulthood. Research has shown that there is a wide range, a higher risk of negative outcomes for those who have experienced ACEs in childhood. Some of those negative outcomes could be physical health issues, which could be obesity, heart disorders, as well as certain types of cancers. There's also mental health disorders that can be prone to those who have experienced ACEs, such as PTSD, depression, anxiety, and substance abuse disorders. And then there's also relational and societal difficulties that can happen, where someone who has experienced ACEs could have difficulty forming long-lasting and maintaining long-lasting relationships in their lives, as well as cognitive impairments. Cognitive impairments ACEs can affect cognitive impairments such as attention and memory, which can also affect someone's academic and professional successes in life. However, all that being said, there are different strategies and interventions that can take place to help mitigate some of the impact of ACEs on a family or an individual. One best way to do it is to do early intervention, having that family and that child go through counseling, parental education, as well as a good support group around them to help them through those impacts of ACEs or preventing them. Another way is trauma-informed care. Healthcare units, healthcare providers, as well as social workers are those who know trauma-informed information are more sensitive to the needs of those who have experienced ACEs. Building resilience is another main important way to decrease in the impact of ACEs, such as coping skills, developing emotional regulation, as well as having a positive community environment around them to help them build that resilience. And another way is community and social interventions, such as dealing with the poverty of the family, dealing with inequality, or anything that's causing a disadvantage to the family, such as lack of access to education or healthcare. These things need to be addressed. Regardless, preventing and decreasing ACEs is a comprehensive approach. Individuals, families, as well as communities and lawmakers need to come together to create a secure environment that can support these families and individuals that have experienced ACEs. As it is mentioned in Matthew 9:35-36, Jesus went through the town and villages. He preached in the synagogue of the good news of his kingdom. He healed all the sicknesses and diseases. He looked at the villagers and the people in the crowd, and he had compassion on them because they were helpless, just like sheep without a shepherd. And here at 4Kids, we are here for you.